Another way to test hip flexors in general is to get the patient to sit on the edge of a couch or a seat with their feet dangling, and particularly if it's psoas you wanted to test, then you want this hip fairly well flexed in the first place because it does that last bit of flexion, and then you can just resist the flexion of the hip there. Now, if there's some sort of medial rotation, which is actually what we've got with Tracy, then what that will mean is that the tentor fasciae lata is trying to kick in to help that flexion. If it went laterally, i.e. this foot went out like this, then it means that the sartorius is actually kicking in a bit more. And if the whole hip went that way, i.e. adducted, then it would mean that the adductors are trying to kick in a little bit more. If the pelvis actually just tips anteriorly, then what it means is that the abdominals are weak and not actually stabilising the pelvis. So although the hip flexors could be quite strong, it's the abdominals that are weak if that pelvis goes forward. So it can tell us quite a lot. So all you're doing is just getting them to resist that flexion and then watching what happens to the rest of the leg.